Thursday.
I don't like whenever I can see my
Method to the madness.
Yeah. Stop, he's so stylish.
So I'm gonna, while everybody's signing, I'm gonna start with one of the most exciting announcements you'll probably hear all week. If you have clinical with me on Thursday. This Thursday, if you have clinical with me this Thursday, we will start at 6 p.m. in the cafeteria. I have to do Wadley orientation for our new batch starting this summer. And so that's from 2 to 5 up there. That'll give me, so my lunch will be in the car, but I'll join you for your lunch to kickstart. So kind of have everything eaten by 6:15, 6:30, because we're gonna hit the ground running with vital signs, patient assignments. Like, you'll still do all the things, but we're just cramming it into that little window because of orientation. So you have clinical Thursday, 6 p.m. cafeteria for my group. McCarty group, Patterson group is what it is, which I think Dr. Patterson, we're done, correct?
Yeah,
All right, it's just McCarty's group, it's the other one, okay.
that would be.
And that's standard, I know. Should we pick? All right, I know one. There. Perfect. Everybody was playing this one to play? Everybody in? Anybody else joining us?
I'm getting you.
You get me. I'll give you a second. You can just shoot the QR and it will do a browser page instead of the app.
I'm calling a friend. Quietly.
And also while I'm in announcement mode, thinking about Chuck and Stephanie, since y'all represent my cohort, the nurse pinning is that April the 28th. If you would like to be our representative slash the handing out the programs, but if that's a conflict for you, that's fine. Let's just, you can find a classmate or somebody. And then of course, anybody else who just wants to come and see what pinning's like, you totally can do that, but. We will report over there at, your call time would be like 5:30-ish. A little bit before, but 5:30 would need you, cause we'll start handing out programs, and then the ceremony is from like 6 to 7. Over, right across the road at the OPAC. And like I said, it is not a big deal. If there is a conflict, that is totally fine. You do not have to do it, but if you do wanna see what pinning's like. Or if you wanna save Stephanie and Chuck the trouble, you can nominate yourself through the, but just would love 2 helpers, that's a part of their.
Everybody don't jump on it at once.
We help with the pinnings, so that we can hand out programs and, get students where they need to go and that kind of thing. And you get to hear Fuller play the piano, so, another part of the game.
Really, Amber? Laugh it out.
Here we go. Don't be scared. It's stuff that you'll very likely know, or if not, it just brings it back to your brain.
Quiz.
All right, geriatric woman with dementia and incontinence, unable to toilet independently. So what is our best strategy for her to maintain independence?
Here's loud quiet, it's not loud quiet.
Okay.
Oh, good.
You did. All right, so when you see the word best, we're gonna go through the test strategy. What's the indicator when you see the word best, most, first, whatever? They're probably all good things and appropriate things to do, but you gotta pick out which one. All right, so does she probably have some overactive bladders, a little old lady with lack of muscle tone? Yes, highly likely. So that's why your bladder training program is going to be a thing, but why is it not your priority? What else is in that question stem that tells you that's not your priority?
The dementia.
The dementia, so we're gonna have a harder time educating her than normal. So the only thing that kind of works for, and then we don't just calf people to calf people, so that's why that one's later. It may be that she wears a pure wick or something like that at night, an external device, but our first line's here, because she's not gonna remember. I'm just gonna establish a routine for her that we just go to the bathroom and try to create some muscle memory from frequent toileting just to keep that bladder empty. So good stuff.
How's she gonna remember to go on a schedule if she has?
She doesn't go on the schedule, we take her on the schedule.
Oh, so she's without.
You're establishing the schedule,
Question, I thought she was like going home.
not going home, hanging out with us. Select all. What should a nurse teach a young woman with a history of UTIs about preventionary measures? How are we gonna prevent the UTIs?
Like that would be fine.
Everything but your water. Alright, so what did we not like about the blue or the B?
You shouldn't limit.
We need
Shouldn't limit, we're gonna stay hydrated to keep those bacteria flushed out. But all others appropriate, so the bowel elimination, remember that helps to keep the intra-abdominal pressure down, which would limit ruptures, tears, cross-contamination, fistulas, all that stuff. Y'all heard of fistulas? Have y'all seen a bowel or a bladder fistula yet? Where they'll, and that usually happens because they're, both are full in constant contact. Cotton underwear for air and perineum, that is the correct way. Woo. Alright. Select all. Which nursing action or actions do you take when placing a bedpan under an immobilized patient? Okay. So if you obviously want them to be on a sitting position rather than supine, you want it to be as natural as possible. If they can do the yellow or C, what else could you use in lieu of the bedpan if they're able to do all that? Bedside commode, or go to the big one if they're able to do all of that. And then call light, yep, because some people have stage fright, and so we may leave them. What's your time limit for how long we're gonna leave on a bedpan before you gotta take them off? 15, because it's like a seated, just like a wheelchair, 15 to 30, but you wouldn't want them on 30 minutes, because it's probably grown to them at that point. While giving an enema, they complain about cramping, 6 out of 10, what you gonna do next? One. If your patient's choking, what you gonna do? Stop feeding the patient. Like, they're really that straightforward. So most of you got that one. Perfect. So it might be that we're going too fast. It might be the solution's too cold, too hot, something of that nature. But the first thing you're gonna do is stop it, and then we'll assess kind of what needs to happen next. All right, so Andrew answered, what is the bare minimum of milliliters per kilogram per hour a patient must do in urine? Hint, it is not 30.
I literally said.
The actual scientific one, the bare minimum. Hopefully you put a decimal. Alright, so 30 is a good center point. I see one. Oh, but nobody hit it. Okay, so there's your answer. So remember that somebody my size versus somebody, I'm gonna pick on Kamaya or somebody, just like, our size and mass does not match. So therefore, it's gonna be a little different. So 30 is a good fluffy number to start with, but the scientific number, 0.5 milliliters per kilogram, it should be their minimum output. And then remember, for your pediatrics, you double it, so it's 1 ml per kilogram for your peds patient, and then for newborn to infant is the double that, 2 mLs per kilogram. So put that 0.5 back in your brain. Okay. Another one, longest amount of time in days a patient can go without a BM before required medical intervention. According to our little old people, 6 hours, but actual, how many in days can we go? And then we gotta do our intervention.
I feel like I'm suggesting. I just put how long I can go.
Oh. You said 7, that's too many.
I did.
Uh-huh. I knew your answer. That's too many.
What? Okay.
Wait, I know people get like
72?
they did hours.
Okay. Alright, 3 days. So the way I remember that in Little Mermaids, on that 3rd day, you gotta kiss the girl before the 3rd day, and you got before the 3rd day.
How did you do go 7 days?
Days, not a month, 14.
And then Ursula's gonna come collect your soul and turn you into Flotsam and Jetsam. Alright,
Oh, no. That's awful.
select all. Which teachings are appropriate for patients with chronic constipation? What's gonna help them go more? Okay,
Okay.
so, good stuff, huh? Alright. Fiber fluids, what's that fiber fluids full, make all that saying, I don't remember the little poem, somebody said it in clinical the other day. Hang on. I don't remember. And then, why don't we like B or blue? There was one, had it just said low volume enema, I'd be okay, because maybe that helps hydrate or
Laxative
something, but
daily.
the laxative daily.
Causes defending.
Mm-hmm. All right, and then one word here, we could say limit gluten, that would be helpful, but avoid unless they're celiac, we're okay. And then the exercise is good. All right, what should a nurse teach family caregivers when a patient has fecal incontinence because of cognitive impairment?
Is this a select all?
Mm-hmm. It's a one and done.
I did, time's up.
What? Okay, so we just said dementia was against the
All right,
training.
what's the difference between, it's not the word dementia, right? So they, cognitive impairment, what could that mean, cognitive impairment?
That means
Forgetful?
physically,
Hmm?
isn't it physical?
Well, it could be that they have an MR, for sure, yeah, they could have MR, or CI, I mean, that's, MR and CI is the same interchangeable term. CI is obviously the more polite, but MR, yes. That would be, a condition there. You also could have like delirium. You can have the starting stages of a dementia, but we don't have it yet. It's just that they're starting to get forgetful. So your first intervention, just like your dementia plan, anything you can do to have a schedule, because otherwise the patient is okay, it's just that they're fecally incontinent. So you're gonna try to do exercises, that would help, strengthen those sphincters, as much. This would be more of once they become dependent, we would do that one. And then, think about pooping, do you poop every 2 to 4 hours? Not unless they got, if they patient with diarrhea, but that's too frequent. And then, what's your, why no on D?
Because you don't wanna, cause you, that
Skin
takes
burn.
away
Is a
from.
all right, what's a sanitary pad? Or a female, like a period pad for females, what's your sanitary pad? Is that gonna catch, that ain't gonna catch enough, that ain't enough cotton to catch it, okay? That's the nice way. So sanitary pad's not enough, they would have to, if they're fecally incontinent, they have to wear the, incontinence briefs. Now, for urinary incontinence, sanitary pad may provide enough cotton to allow them to still wear standard underwear. But for stool would not. Alright, patient states I have diarrhea and cramping every time I eat ice cream. What should you expect? What should the nurse do? Don't feed the patient ice cream. Oh! Everybody should get that one. Perfect. What blood tests or lab values an indicator of a patient's renal function? You can type me some in there. However many you want, you can, because I can click and add.
I can add everything.
Put your best one. You only can put one, just give me the
Oh, I
best one.
put two on there.
I put
Two
two.
is
I'm
fine.
gonna
Yeah,
add.
two is fine. I can add, it's fine.
I was just going down my list.
Crit and bone,
That's what I put.
so,
Wait, no, that's what I put.
I know, I can alter.
Okay.
Some spelling, like creatine, that's protein. That's not your technically, but I know what you meant, so.
Wait, where's mine?
Ooh, who put GFR?
I did.
I wish I could assign bonus, that's
Hey,
a
that's a
really good
CFR,
one.
not GFR.
I
Huh?
just can't spell
What's
it.
CRE?
Huh?
Oh.
Creatinine, they just, it should be CRT,
I spelled,
but we'll take them.
I'll do GFR this week.
Alright,
You had to do one.
nurse teaching an older female how to manage stress and incontinence at home, she instructs her to perform those little jade eggs. What?
I don't know how to do this.
Everybody needs to do them, we just don't have anywhere to put egg, don't answer that, anyway. Okay, Kegels, yes. What is the most significant change in kidney function that occurs with aging? Very easy,
Oh,
Really?
very easy.
okay, perfect.
Think about old people, read your verb, and that ought to eliminate 75%. Alright, so do old people grow anything, get more muscle mass, more tissue, more new blood vessels, no. Old drying up, decay goes away. So the only one that said dry, decay goes away is your decreased GFR, they slow down. So that's what promotes the possibility of drug sensitivities and drug intolerances because of the buildup and the lack of excretion from the kidney. To assess whether there is any improvement in the patient's dysuria, which question can the nurse ask?
Oh, nuts. Got it mixed up.
That's gonna be the new line that Velma says in Scooby-Doo. Instead of Jinkies, all nuts. Alright, so let's go through all of our ureas. So if you have to urinate at night, that is nocturia. Do you have blood in your urine? Hematuria. Do you urinate frequently? Polyuria, and then pain is gonna be your dysuria or discomfort. Hmm? And then oliguria is little urine, and then no urine, anuria. And urine. Woo-hoo. All right, patient with possible renal insufficiency after surgery is ordered a creatinine clearance test. What item is needed? What else is also needed and not listed here?
What? Oh, yeah, right.
Yeah, creatinine clearance test. That is the fancy word for your 24-hour urine test.
Oh.
That's your 24-hour urine, so you're gonna need that big old orange jug, and what else that's not listed here?
Ice.
Tubs of ice, and keep it on ice, because that stuff goes quick. That's why I hate Zaxby's ice. I love to crunch on it, but it is useless for a urine specimen like that, because it's water in 2 seconds. So if you can go down to the kitchen and get the large cubes, you'll save running on that little tub all day.
It's from that place.
Nurse completing an assessment, unable to feel kidney on palpation, what should the nurse take? So turn to your partner if you don't know and palpate their kidney and put.
You got a sore throat, buddy?
Did you feel a kidney on your partner? No, it's not, it's normal finding to not palpate a kidney. So, but if you did palpate a kidney, you would want that ultrasound because we might have a renal mass or cyst, something of that nature.
I
I feel like I should see.
Just document it. All right, true or false? An indwelling catheter is usually preferred over suprapubic catheters for long-term continuous drainage. All right, it is false. So suprapubic would be better for chronic because it's external, rather than going through all the internal structures, and it's less likely to cause severe infection. Very common for patients with suprapubic catheters to have chronic UTIs, but over time, the bacteria will what they call colonize, and they'll just take a daily antibiotic, usually Bactrim, and they'll just do suprapubic care every 30 days. But it's less invasive because it's restricted to the bladder rather than all the urinary structures where it can cross over to the bloodstream. Which it still can, like I said, they're still gonna have them, but it's just better. When collecting a urine sample, the first voided urine of the day is not collected because it is not considered fresh.
Oh, I put one on now.
Yep, true.
What?
So remember, you save it the next day, if you're doing a 24-hour collection. The reason you don't use is the same reason when you do a midstream, because it's just been sitting and stagnant. So for a urine sample, you're gonna do a midstream, or you're gonna toss the first void, take the second one because it's moving. Because all that peaks out overnight, but the next day you're gonna get it, because they're just gonna get it for the amount and you're done collecting, so they're gonna run the test and it's done, it's not gonna collect bacteria. What is the most common organism that causes UTIs?
Lemonade.
Hint, hint, usually from hygiene practice.
I think this.
Gonorrhea.
We're trichomonas.
True.
Mhm.
Oh, it is.
Was not a trick, it was E. coli. So from hygiene, most of you got that. Okay?
I thought it was staph, honestly.
The involuntary, that's your skin infection. Involuntary loss of urine that occurs after feeling the urgent need to void. Gotta go right now.
Oh, it's solid effort. That means I got it wrong.
I don't know.
It is a little bit.
Oh, I got it right.
It is urge. Good job, y'all. Let's go through them just to make sure incontinences are swimming in your brain. Stress incontinence, what are they usually doing that causes that? Cough, increased intra-abdominal pressure, bending over, jumping, anything like that could cause it. Then you had functional incontinence. What is that one?
Where
They can't get their
They
body.
can't get to the bottom.
Yeah, it's so like motor mechanism. Yeah, I can't get the clothes off. Couldn't get the key in the door to get in, whatever. Urge incontinence, that's where by the time they feel like they gotta go, it's too late. Overflow, that is where their bladder is to the point of bursting and just it goes because it's like, I can't hold any more, release. And then mixed incontinence is obviously any of those options. And then you of course have the neurogenic bladder, which is where the physical structures would work, however the signal to the brain doesn't allow the sphincter muscles to work. What order should you perform an abdominal assessment? Back to 112.
Oh, nuts.
Because remember, your abdominal assessment is different than standard.
On time, on point.
Okay. So normal procedure is to do what?
Look at it and then
Look.
listen, feel.
And that's why we teach you to do it that way, and then palpation and percussion would be, but the reason that you do percussion first is because or before the palpation, is because you can change the muscle tone of all that's going on. For like palpation, it'll knock some of those sounds out or around or down. So percussing for resonance first and then palpate, but y'all got it, so I'm not worried about it. Rock on. Last one. Patient admitted with severe diarrhea, what electrolyte is gonna be out? Easy peasy. Why is it taking that long? It's the one you're always worried about. Potassium.
Oh, put me in 12, you said it after that?
That's one that's gonna kill them. You also are worried about sodium with the fluid loss, but potassium's the killer. So who wins?
Third place, y'all.
Hey,
Never gonna happen
you're on the leaderboard. Little pirate panda. Panda.
Get it, girl.
She got her little Easter chick ready for a couple weeks. Alright. Boom, so hopefully those are swimming back in your brain.